Yes, I will.
Well, good afternoon, everyone. It's my honor to be here today. Thank you for inviting me, Kala. You know, as was mentioned, I was the police chief here for 18 years. And, you know, this is a lot different job. There I was public facing, you know, I was always talking with the media. I did a lot of public presentations. I was at all the community events. Well, this job is a lot different. It's more behind the scenes. And this first department we talk about here is really behind the scenes as well. You may not know that we even have an emergency management department or really what that they do. But each and every day, when you're home sleeping, when you're home with your family, they're on duty working almost 24/7, looking out for your welfare and for your safety. We have 6 people full-time and 2 part-time. These are a list of things that they actually do. The first thing is the comprehensive emergency plans. Now, these are all hazards. These might be for tornadoes, floods, terrorist attacks, whenever maybe somebody would shut down the computer system across the country, mass failures of utilities, or even pandemics like we're seeing right now. We have probably a 4 or 5 inch book that has these plans in them. And these aren't just something that we write and we hang on to, that we actually push out to the community as far as in disaster preparedness and outreach and education. We do our own training internally with our own people, management training, and then we have training exercises. We practice all of these different things should they really occur, so we can make those mistakes and learn things from those exercises, so when it really comes to it, we're better prepared. The outdoor weather sirens are something that emergency management does too. They have very specific guidelines as to when they set those off, but they're there to warn folks about inclement weather, something that may be threatening to them. We have grants, emergency funding reimbursements that we have anytime we have one of these big events. For example, you'll have the president or the governor state that this is there is going to be money attached to a particular event because of the size of the event, the losses that are seen, whether it be a tornado or something that we see now with the pandemic. This department has to track all of our expenditures and get that money back from the federal government or state governments and back into the coffers for the city. Right now, we're looking at CARES funds, which are specifically for COVID-related expenses, and we're going to be reimbursed something right now to the tune of $5 or $6 million from the federal government for what we've expended for the COVID and what you've expended as a community with us for our COVID approach. We have FEMA money as well. I might mention that's usually about 70% reimbursed, and CARES is 100% reimbursed. You want to flip to the next slide. Now, whenever we do have an emergency and emergency management goes to work, as you can imagine, for example, you have a federal government, you have a state government, you have a county government, and you have city governments. And you can be assured that when something like this happens, we all have the same framework we work within. That's the National Incident Management System. They call it NIMS. And this is really a comprehensive approach that we use. And it doesn't matter about the size of the incident or type. Whenever it goes across city lines, county lines, state lines, it grows with the event. And everyone is involved in it. We plan together. We share resources. We communicate. You can be sure that that's going on at all times. Our communications involve not just the government, but it also includes medical communities, our utilities, schools, any kind of large venues, faith-based community, corporate. Everybody is involved in our plans, and everybody is involved in the NIMS system as well. We have to share resources. You can imagine if there's a tornado, the resources that might be needed, dump trucks to clean up all the debris. Well, each entity may not have enough dump trucks. There may be more damage in one area or another. So what happens is the cities will make requests to the counties who go to the state, to the bigger picture, and then they'll decide what resources are needed so we don't deplete our resources in one area, and they divide those resources to where they're needed. So this is the way that the NIMS system works. Please hit the next slide if you would. We also have, to help us in emergencies, to activate this system and use this NIMS system, we have an emergency operations center. This is, as it says, our central command and control facility. We stood this up on March 22nd for COVID. And what we did is we brought all the affected directors of the city departments together. You can see the picture there when you see the computer in the big room and the signs up above. And the signs up above designate the different areas of the NIMS. For example, operations, planning, logistics, finance and administration. And we have different people assigned to those different functions. And they'll sit in those areas, and we're all in one room, and we all are there to plan together and to respond together to better our community and to keep our community safe. With that, we also have daily meetings every morning, Monday through Friday at 8 o'clock. We started out at the command post, EOC, having meetings where we'd all get together in a room and talk about what's going on, what the statistics look like, what the needs are, what the PPE or the protective equipment is, the supply of that, whether or not the hospitals need it, the nursing homes need it. We get everyone together and we brainstorm on what we need to do and bring everybody up to speed. Well, as you can guess, through a pandemic, we realized very quickly that you can't put that many people in one place. So we started doing it as we're doing today on the computer with Zoom. And we have these Zoom meetings still Monday through Friday at 8 a.m. with everyone from the city involved, planning and bringing each other up to speed and determining what we need to do. There you go. Here's just a few things that we've done from the EOC that I would like to talk about. I know there's not a lot of time today. We could probably spend the whole hour talking about this, but I'm just going to do it very quickly because I know Shannah's got a very important part, and her part is going to be where you get answers that you might need about COVID from the city. But anyway, we started off with a COVID demand ambulance. This is a dedicated ambulance that does nothing but pick up COVID patients. As you can guess, the spread of COVID is vitally important to us. How do we make sure that doesn't occur when we treat people? And we thought that a dedicated ambulance just for COVID patients would be the way to go. And that worked out very well. We had that in service for about 2 months. And after it started to die down a bit, we took that away. We just answered calls regularly with all the ambulances. But we certainly have that ready to go in case we see another upsurge, which, as you know, we've seen increases in numbers of cases. And we will always have that there if we need it, though. It worked very well for the first couple months. We also put paramedics in the Emergency Operations Center and our public safety communications. That's our dispatchers. They dispatch fire calls, police calls. We had them in the public safety communications to triage calls. So when we get a call, someone has symptoms, these paramedics using our doctor, and you see down below Dr. Gamber is our director for our Plano Fire Rescue. We have to have a medical director that directs our paramedics and oversees them. And also when they're en route, for example, or treating a patient in the field, he can also get on the radio and advise them how to better treat them and prepare them for transport. So when they come in, he's ready to go to work there as a doctor. We then, for the EOC, the expert that we had for medicine was one of our paramedic lieutenants. And he was in there also to give us better advice and to communicate with Dr. Gamber. Dr. Gamber is kind of like our Dr. Fauci for the federal government. He's the person we go to. He's our expert that's helped us through this. And as you know, with COVID, the medical community was learning as they went along. They didn't know everything from the beginning. We saw that we're still learning. Things are still changing. You saw that some of the orders have changed as well. We get from the governor, some from the city council. So we try to keep on top of that. But Dr. Gamber is very good to help us understand things better. We can ask him questions. Personal protection equipment is next on the list, PPE. And that's been a real problem because at first there was a very big shortage of PPE in the United States. They started importing a lot of that from China and other places, which helped a lot. They started producing it at higher levels. But we watch PPE very carefully for this area because we have hospitals that depend upon it, doctors' offices, dentist offices. And now, of course, we have the mask orders for people who are wearing masks. We want to make sure that we have the equipment to get us through this pandemic. So we have a supply of that in the city. and we look over the supplies throughout the entire community and the entire area. As you can guess too, whenever we had city operations had to change during the pandemic, we shut City Hall down. We reduced services because we had to protect the citizens and our employees as well. During that, we took people from areas that they weren't needed and moved them to areas they were needed. We shift those resources as they were needed to keep our community safe. One of the things we recognized that people wanted to get out. When they were in the house all day, it's very difficult to sit in your house when you're not used to doing that, not going to work. And with that, we recognized that there were some problems in the parks with people social distancing. So we took some of our people from the libraries, and we took our people from Parks and Recs, since Parks and Recs at that time were closed, and now we're open about 50%, and moved those to the parks as park monitors. And that was a very good program, very popular program to ensure that we have safety in those areas that are highly used. We're always looking at reopening city services. We closed strategically, and we're going to open strategically as well. But you can be sure that we're going to be, safety is going to be paramount as we do open city services. We are going to follow the governor's orders and advice from the feds as we do that. We do have a company that's coming in. We're hiring an outside company to look at the city as we reopen and to ensure that we are doing all the right things as we do that to make sure we're as safe as possible. The city has also taken on grants, care grants from the county. We got $16 million from the county. We immediately put $5 million aside for the first tranche for small businesses. And we're currently going through our first phase of that small business money. We then have money saved, $5 million for a second tranche, possibly later for a second period for small business costs, and then $6 million for reimbursement costs for the city for those care grants. So if you do have a small business or you know someone that has one, make sure you check our websites and check our communications, and Shannah will talk some about that as well, where to go to find that information, because we have money to give out to people that need that money. We want to make sure that we do it as widest as possible and cover those people in the community that need it most. So with that, I'm going to turn it over to Shannah. That was my quick introduction, kind of telling you what we do as a city when we have a pandemic, or how we prepare for that, and what we're doing up to now as far as behind the scenes. And now she's going to talk about what's in front, what's front facing to you as a citizens, and there to help you, those resources. Shannah?
Thank you, Greg. Hi, everyone. I've been flipping through the screen and I see so many familiar names to me that I see you commenting on our posts and Nextdoor and Facebook, and I feel like I know you all already. So I really appreciate Kala and the Neighborhood Services team for inviting Greg and I to join you today, and for an opportunity to put some faces with names. It's great to see you. I want to tell you, Greg was going over all of the things that we've been doing at a high level. And one interesting thing that happened on the communications side in the EOC, at the beginning of the pandemic, Plano is very passionate about making sure our residents, our businesses, our nonprofits have the information that they need to make good decisions, to take care of themselves, to be good residents, all of those things. And so we affirmed that in the EOC, that one of our guidestone principles that for however long COVID lasted is that people come first. And we wanted to make sure that you got the information that you needed as quickly as we could get it to you in a platform of your choice. So what I'm going to talk about is where you can find information. So what public information has looked like and the information sources. And then I'm going to take you on a little bit of a walk through some of the resources you may not be aware are available, and show you how to find those for yourself. Because as we know, there's just a lot of information out there from the news media, 24/7 television, our neighbors, multiple social media platforms, our family members. There's a lot of what we communicators call noise, and breaking through the noise can be a challenge. So consider me your tour guide today of where things are coming. So every day, those of you who are on Nextdoor hear from me every day. And that was one thing that we decided was pretty important, would be that I would be the main point of contact for COVID in Nextdoor, so that you actually had a name and now a face to put with that name of somebody that you could ask questions, and you could ask your questions in the comments. You could send me a direct message. So every day you get an update on the current case information that we have. Now, early on in the pandemic, the county, Collin County, Denton County, we're doing case management and contact tracing, all of that. You probably are aware in Collin County that responsibility was transferred to the state. We took a pause in reporting every day until we started getting information again. So I've got a sample of the chart that we push out. This is based on information that we receive. We post that in Nextdoor because we know Nextdoor is all of our residents. We post it on Reddit. There's some 7,000 members of the Plano community on Reddit. By the way, over 100,000 on Nextdoor. We also put it on our City of Plano Facebook page, and we put it on Twitter as well. So we have a reach. I don't know if those are all unique users, but all of those together reach more than 500,000 people every day. And right now that goes all the way through Sunday. So when I say every day, I mean every day. And then oftentimes in the afternoon, we'll have an update. Early on in the pandemic, sometimes we were posting 2 or 3 times a day on all of those channels, just getting you information as soon as we had it. And of course, everything's on our website. We'll talk about that in a moment. Steve Stoller, who is our Director of Media Relations and a counterpart of mine, we office out of the same office in City Hall, puts out daily press releases, same information. We know that not everybody is on social media. Not everybody has internet access to go to our website, but a lot of people have televisions. A lot of people receive some type of print media. So a press release with this information allows us to reach people in a different way. So we want to make sure that you are armed with the data you need to make the decisions that are appropriate for your family, your business. But that's not all we do. We've done email outreach. We operate 13 different newsletters. Those are all very targeted. If you're not signed up for any newsletters, let me suggest 2. One is the Best newsletter, which is operated by the Neighborhood Services team. And since you're part of the Best Break session right now, that's a good newsletter to subscribe to. The one that's the general one for the City of Plano is Plano City News. We distribute that to almost 40,000 people, and I certainly would love to have that be 100,000 people. So you can get to those newsletter signups by either sending me an email or through our website. Every week we're pushing out information through Plano City News, and then we're doing it to Sage, which is our older adults newsletter. We're sending information out to the Plano Parks and Recreation newsletter list, the Plano Library list, information that's relevant to people who are interested in those topics. So we're making sure you're getting COVID information, and a lot of those deal with the issues that Greg was mentioning: changes in services and programs, when facilities are going to be open, what you need to know before you go to those facilities. We also have a great monthly podcast, the Inside Plano podcast. That's why I asked Kala if we could record this, because we'll share this out on the Inside Plano podcast. We reach more than 1,000 people through that podcast every month, and we've done a lot of good information there. You can always listen to back episodes of those. It's available online. We've put in print, we've done a mail out through utility bill inserts. We do 2-page spreads in Community Impact Newspaper Plano, which goes to every mailbox, business and residential, in Plano. So it's a pretty good circulation. You can look for the next one in the next issue that comes at the end of July. We've held a town hall on COVID, and one of my favorite things we did this year, I don't have kids at home, but a lot of the kids in the Sunday school class that I teach had a lot of questions about COVID. And I thought, if these littles that, I'm trying to teach over Zoom on Sunday mornings have questions, I bet there are other kids that do too. So we reached out to PISD, and together we did a very special town hall just for kids and questions that kids had about COVID. And that was great. Mayor LaRosliere answered their questions, and part of that town hall ended up being broadcast on our local news stations too. So we got good reach for messaging that was appropriate for children who are, just as confused or more confused than all of us are with all of the changes we've experienced. And then on our website, we have a host of downloadable resources. I actually have one up here on the slide. It's 8 healthy ways that are tips that you can do to stay healthy. You know, one thing that we know about COVID is that it's a virus, and there are certain things that you can do to protect yourself against a virus. And you've heard these so many times, I won't bore you by repeating them, but we all know the big 3. Wash your hands, you know, keep a safe distance. So if somebody sneezes on you, the sneeze particles don't get on you. And then, of course, the one that the governor has asked all of us is, if you can't social distance, wear a mask, because it protects others from particles in your breath, and it protects you from particles in their breath too. So there are actually 8 different ways, and those are all guidelines from the CDC. We have this available in multiple languages, and we're very grateful to our nonprofit community who we were able to reach out to and say, please help us translate. So you'll find this in a multitude of languages on the website. This is what I want to spend most of my time talking about. And I won't make anybody, raise their hand in the chat to say, oh, I visited the website. But if you haven't, I want you to put this website address. I've got it at the top of the slide. You need to bookmark that, because this page is, it's like the closet for Narnia. You open it up and there is far more in the wardrobe than there is just on the page. So plano.gov/COVID-19. And that's going to take you to this basic page. And I'm actually going to hopefully open it up and have everybody be able to see it. We'll just pray that it works. Oh, look at that. Okay, so we're going to do a little, can you see the website live, or is it still on my slide? Okay, great. Thanks, Kala. So we're just going to do a little show and tell, and I'm not going to take you into the weeds. I just want to show you, if I peek behind each of these buttons, the kind of information that I'll find. And that way, your mission after this session is to spend some time on this website, because you'll be shocked at the resources that are available. And a lot of the questions you have, you'll find right there, because there are only so many times that we can put it on social media before people won't even actually really see it anymore. So this is the homepage for plano.gov/COVID-19. And you can see I have 6 main boxes here. This first one, cases of COVID-19 and testing, I'm going to open it in a new tab because I'm afraid if I have to go back and forth, I'll make mistakes. So this is our dashboard. So every day in Nextdoor, the last line of my update says, for more information, visit the City of Plano's COVID-19 dashboard, and it gives a link, and it takes you to this. So many, many times, the next question I see in the Nextdoor feed is, well, how many people are recovered compared to how many people are active cases? Well, look at that. There's a wonderful little chart right there. You can see that. You can look at the zip codes, and you can look at all of the detail, how many deaths we've had in a zip code, how many cases, on and on it goes. Whoops. You can zoom out, obviously. Let me see if I can scroll down. So I'm not, there we go. We can look at the cases and the timeline. Those charts that we used to post, we just put it in here now. You can look at Denton County versus Collin County. You can get data on the entire region. And some of these parts take a little bit of time to load. Be patient. It's based on data that we're pulling from other sources. And so it's the speed of the internet at the other end, not necessarily your internet speed. This is a great one. This is from UT Dallas. It tells you the hospital capacity information. And so you're looking at our region. You're curious about how many ventilators are used? Look, it's all there. And you want to know, hey, I want to get a test? You can get to the state of Texas test map, and you can find a test location that's near you. All of that information is right here. So that's that first box. Well, what if I need to get some help? Let's see if I can get there we go. So all kinds of help. We have resources for businesses. The grants that Greg was talking about are all here. Let me open up that page. So we have signs that businesses can download asking customers to wear masks. More than 800 businesses, I looked at the numbers this morning, more than 800 businesses have already downloaded that sign to hang in their business. So we've provided that resource for them. We have a link to the Chamber of Commerce. If grants are available, it's right here under financial assistance. So you can see that the CARES Small Business Grant Program, it's closed right now. This first round that Greg was talking about, the applications were through June 22nd. So when a second round opens, We'll, of course, message that out on social media, and you can get to the application through this page. You don't have to go find it on the City of Plano website. Just go to this page, and everything you need is here. So I would encourage you to scroll down. There's state resources, there are federal resources specifically for businesses. What if you have food insecurity issues, or you have concerns about at-risk needs and you want to know if there's special shopping hours? Our great team at the Plano Public Library has been faithfully calling all of our local pharmacies and local grocery stores every week to get updated times for senior and at-risk shopping hours. We have all of that here. We keep a list through our friends at Visit Plano of what restaurants are offering to go. If you don't feel comfortable eating in a restaurant, you want to know, who can I buy from so I support my neighbors who own local restaurants? That information is there. Food pantries and hours. The PMAP program, which does grocery pickup services. You order the groceries, you pay for it, you work it out with them, and they do the pickup and delivery to you. All of the details are there. All kinds of helpful links from the City of Plano website. We have our hotline phone number. We have FAQs. We have information on if you want to submit comments on council agendas, on planning and zoning agendas. If you want to know what the Senior Wellness Center is doing, we have it here, just more than I can even talk about. And there are those downloadable resources if you want to get to that. Oops, I don't want to click the same one again. Sorry about that. I'm a fast clicker sometimes. All right, housing resources. So a lot of these are managed by the neighborhood services team. So when you land on these, if you click, you'll end up on the neighborhood services website, but you can get to them all through plano.gov/COVID-19. If you are in need of rent and utility assistance, we've got, these are just jump links. So that just gets you down to the section you need. So if you're at risk of losing your home, there's temporary assistance. Same thing for rent and mortgage assistance. There is the Collin County CARES Economic Recovery Program that also provides rent, utility, food assistance. All of the information you need, as well as resources to apply directly, can be found on this page. Now, the one thing that maybe we don't talk about a lot, but is very real, is the impact that COVID-19 and this uncertainty that we all feel has on our mental health. And I think that we shouldn't discount that at all. It's a very stressful time right now. And I personally feel like I've lived a decade in 4 months. I have had my first, shall we say, extremely blonde hairs appearing because of the last 4 months of pressure. I'm not the only one that that's happening to. There are some wonderful resources that are absolutely free that are available here. Some of them are administered by the state. Some of them are administered by LifePath Systems, which is Collin County's mental health authority. We want you to use these. Taking care of yourself physically and mentally is very important because we want you to be smart and stay healthy, and staying healthy involves your mental health as well. Finally, we know that there's been significant impact on economics. So we have assistance for workers. Now, we said we had assistance for businesses. That would be business owners. But if you were an employee that has been impacted, you'll want to click on the workers assistance button. You can get to a job board from the Plano Chamber of Commerce. Get Shift Done is an initiative throughout the Dallas region that is focused primarily on individuals who were in the food service industry. It's a great, great program. CDC guidance, all kinds of information, as well as what your legal resources are due to recent actions by Congress. So great information there. All of that is under that Get Help button. So that, like I said, it's like the Narnia closet, right? You opened that wardrobe door and it took you a long way down. We could go into current orders and protocols. You're like, what does that mean? That means what are the new rules and the things that the government is telling us? That's what an order or a protocol is. So here's what we can tell you has been said. All right, so these are the things from the City of Plano, things from the governor, things from the state health department, all the way down through the CDC and Collin County. Additional information, I get questions about guidelines for churches all the time. Our Attorney General's given some great advice. So as soon as he updates that, we provide the updated links. So you'll find all of that. Current orders, that's what we're being asked to do by the government. You want to know what's open for the City of Plano? our current city facility closures, which are becoming more opens than closed, are found on this page, as well as any changes in hours and service points. The FAQs are here. Now, we don't answer all of your questions because, believe me, I get your emails. You have way more questions than I can put on a web page. You'd be on this one web page forever. So these are kind of your top questions. Like, how do I find a test? How do I find answers? Things like that. And then those press releases that I mentioned are right here. You can always get to those every day. Let me see if I can get this to get back to my show. All right, so that's the website. Everybody knows now, if we have a question, we're going to go to plano.gov/COVID-19 because a lot of details and actual help is found there. Now I want to show you, I have this little arrow. When we were on that website, you saw that little live chat off to the side. So this is a cool program that we worked with on our technology services team, and it's tied to a service that we offer that you're probably aware of, our COVID-19 call center. Now, the call center is staffed by several different people. Greg mentioned earlier that, clearly certain services were closed down, but we were able to repurpose people to do other jobs. So this is a very important job. This call center is operational Monday through Friday, 9 to 5. They field anywhere from 15 to 50 phone calls a day. And then that live chat is also staffed by these same individuals, and they answer anywhere from 5 to 20 live web conversations a day as well. And by the way, if you call on Saturday or Sunday or after hours, it goes to voicemail and we call you back. So it's not a doctor's office. We don't provide referrals to go get your COVID test. But what they're really doing is, like I said, you have a lot of questions, more questions than we could put on the website for you to find easily. They have 37 pages at last count of answers to questions that we've had. Everything from, hey, I'm a business and I can't figure out how do I even start calculating what the governor has said is my occupancy, to where do I go find where the testing locations are, and everything in between, are playgrounds open? All of those questions, these individuals have been trained to help you problem solve. And they can also point you to where the information is. And they are just great folks. I look at their call logs every day, and the amount of help and care and attention. They are not on a clock. We're not saying you have to get off the phone in 3 minutes. So there have been calls that have been an hour long where they just really work through and help people get the information you need. So 972-941-5922 is the COVID call center, and they are there to help you. We also have, I wanted to highlight, these were all on that Get Help section, but these are the three big things that I hear outside of where can I get a test. These are the three things that people are concerned about. And I want to make sure that you are aware that these specialized resources are there to help you. First, we knew early on when the governor asked people to stay at home as much as possible, unless they could not stay at home because of work or needing to get groceries. We have an aging population in Plano. I mean, all of us are aging, right? But we do have a lot of people who have opted to call Plano their forever home. Grandchildren are staying here, children are staying here, so grandparents are staying here. And that's a wonderful thing because it makes us a more close-knit community. But what a challenge that is if you're used to going to the Sam Johnson Recreation Center and spending your lunch hour there with your friends, or you go to book club at Plano Public Library and the book club is closed, or you have a wonderful group at your faith community that you meet with every week for your lunch bunch or your Bible study or what have you, and you can't do that because COVID seems to be disproportionately affecting higher age groups. And we also know that we need to be careful and stay at home. There's a sense of isolation. And I was talking about mental health being super important. So one thing that we started with our Plano Public Library staff were what we call senior care calls. And you are welcome to sign up for the service. The information is at plano.gov/COVID-19. And they will call you every other week. And this isn't a call to say, hey, how's it going? What do you need? Checklist. It really is a conversation and some really wonderful friendships have developed between our seniors and our library staff, and it's just such a wonderful thing. I don't get reports on those because really it's a friend calling a friend, and nobody's privy to that conversation. Although if individuals do need help, that team also can get them aligned with resources in the community. And then those other two items that I pointed out when we went through the website, but it's very, very important. As economics have been affected, we know that there's still bills to pay, and we want you to know that there is help available. There's a process to follow, but there is help available. So please ask for help. Don't be afraid of doing that. The federal government has made resources available. So rent and utility assistance. Man, I was without power for 30 minutes last night. Encore fixed it, super quick. But if that was a longer term thing, this is a bad time to be without AC, right? So if you're in a situation where you can't pay your utility bills, this is a bad time to be without power. So we want to take care of you. You'll want to get in touch with our team. There's food assistance available. So make sure that you take advantage of those things. They're here for you. We do share out that information on a regular basis as well. I know that I've gone through a lot of information. I was just looking at my watch to make sure, because I know Kala wanted us to leave time for questions and answers. So I think, Kala, I'm going to stop sharing my screen so that you can take back over. And if there are questions, we're available to answer.
Wow, thank you. That was just a lot of wonderful information. We do have one question that's in the chat house, and Keisha also sent a message to everybody that mortgage assistance is also available. But there was a question regarding with the change from reporting to CDC to reporting to the White House, will Plano continue to do the COVID dashboard with data directly sourced from Plano hospitals? I'm concerned with the White House change that the data you use will not be sourced from its local hospitals. Comments there.
Greg, I actually don't know the answer to that, because for us, everything is being managed by Texas State Health Department services. So are you aware of the impact of this?
I'm not. I think that our information will continue what you see on our website. We did have one slight change in the reporting, and we've got that worked through. But as this is not the first time we've seen something change a bit. As you know, this is a fluid situation. But I expect to be able to continue to provide the same information that you were just shown by Shannah, which is very detailed in graphs, and you can look at it many different ways. You can really get a lot from those statistics.
Yeah, and to that point, we try to give you very high level information. I know that many times I get emails and requests, would you please provide information this way and give us context? We want to give you data, and then you can do data analysis, but we want you to have the highest, cleanest data available to work with from that point on.
Information is pushed up, but also that's accumulated at the lower levels. And we're able to share that. We've had no problem with that one glitch that we had, and we got that resolved very quickly. So we anticipate still providing information on those things that are important, those statistics, including hospital statistics.
Are there any other questions? You can just unmute yourself. If you're having trouble unmuting, just put something in the chat, and sometimes Zoom doesn't always cooperate, so.
I have a question. With the Plano schools, are they considering delaying the opening at all?
Well, as you know, Plano Independent School District is separate from the city, and they do have a back-to-school plan on their website. They put that out the other day, and from my quick read of it, they were looking at possibly having some in classrooms and some going from home, but you can look for that yourself. But that is still being debated and looked at. My son's a law professor, and I know he's teaching the full year in Chicago from home. Every state is a little different, but that's still to be determined, I think. But for right now, you can go online at PISD's website and take a look at that reopen plan that they have.
Okay.
I see the question in the chat about soccer practices with no masks. And, you know, I'm dropping it in to the chat so that it's easy for you to grab. There are all kinds of guidelines. The governor set up a strike force. So it's the strike force to open Texas, and they have very detailed guidelines. Now, again, guidelines are recommendations. So it's consider it a very strong encouragement, but it's not a mandate. And these are the things that they consider minimum health protocols. So I gave you the links for both those who operate sports events and those who participate, so families. And they actually have guidance for adult sports leagues as well. But since the question was about youth soccer practices, each club seems to be taking its own approach, but you can go back through and see what the government's recommendations are. So we have taken a position where we defer to the guidance that is being developed by the governor's team and that is pushed out through the strike force.
Thank you.
Exercising outdoors or engaging in physical activity outdoors is an exemption under the mask order from the governor, but they still have to maintain a safe distance if they're not from the same household.
And we know that's a challenge, you know, but it's more of a challenge of just adapting our own behavior too. I was thinking, I'm here in my office, you can see, and I've started, some of my staff members are working on site instead of teleworking right now. And so I had a mask on while I was heating up my lunch, and I realized, gosh, I might lose weight on COVID because here I am heating up my lunch, and I didn't realize how often I just conveniently licked the spoon until I had a mask on. You know, that's a behavior change, right? That I have to start myself, and it's an unconscious thing. And that's something about when Greg talks about maintaining distance, things that we just don't even think about. We need to work to change that practice that we have.
Great. Any other questions? As more people return to work, will rec centers return to normal hours soon?
Oh, that's a good question. Let me look at what the current hours are while we're talking, because they are adapted hours. Greg, you might be able to answer some of the questions on.
Well, I'm in the rec center every day, so I know when they close.
Yeah.
But they do have shortened hours.
Mm-hmm.
They are open each day that they were open prior, but rec centers aren't going to open further until we can do it safely. And right now we're seeing an increase in the number of cases and deaths, and it's concerning. And you probably, like we do, you can look at the statistics online or you can listen to the news. And so we're still weighing that out, but we're going to make sure that we don't open prematurely and endanger people. And when you do go to the gym, you'll see that you're going to have to wear a mask when you exercise inside with the weights. That is a rule at Parks and Rec as well. But, you know, I've been going for years to Parks and Rec, and it's always been very well used and full, but there's hardly anybody there now. I feel it's safe, you know, that's why I wouldn't go otherwise, because I am high risk at my age and medical conditions, but we are doing a very good job of making sure that it is a good, clean environment and that we take precautions in the gyms. We're going to continue that as we open. I know our city manager has said that safety is going to be number one as we reopen.
And it does look like some of those hours, although, you know, it's not quite as extended as it was. If I recall, prior to COVID, because I'm also a member of our rec centers, I believe that they opened at 5 a.m. They open at 6 a.m. now. So they're open 6 a.m. to 8 p.m. Monday through Friday, which should handle the swing of most people, whether they're first shift or second shift. So it's maybe not quite as broad as it used to be, but it is a good range of hours.
Oh, I was just thinking, can you hear me? Okay. Yeah. Okay, good. Just curious if we, opening at 5, you have a lot of people that work out from 5 to 6 as opposed to 6 on. There's a lot of people, 6 o'clock's too late for them to get there to go to work. They've got to be at work at 7 or so. So that's just, shifting back to the 5 a.m. mode has some meaning for people that work out early.
We can pass that feedback along. Be happy to do that.
Kelly, I appreciate it. And anything y'all think that you'd like to see addressed, please let us know. That feedback's important. Thank you, Kelly.
I see a
There's-
question about the mask ordinance by the council and mayor. Greg, I know that you can address that. The question is there any chance that the council and the mayor will readdress Plano's mask ordinance with the increase in cases?
Well, the governor's order superseded that basically. And so we're following the governor's order for masks. He's taken an approach to direct the state, everyone in the state on masks. And so that is our order that we're following now.
Any other questions? John saying no, no, no. But
No, I'm surprised. I was prepared to be overwhelmed by questions because golly, it feels like every Nextdoor post has about 200 comments each day and 100 and something on our Facebook posts. But sometimes those are conversations more than questions.
Well, Shannah, you provided them very places to go to get all the answers.
So,
And so I think they're all waiting to get off so they can go on there online and take a look, hopefully.
right.
well,
Today's one of those days we'll have a second post, by the way, in Nextdoor and Facebook. So look for a post from us. We're going to remind you of those health tips that you can do. And if you weren't tired of hearing my voice, you'll hear my voice again in a video that's going out this afternoon.
Yeah, I've got one thing that might be helpful as so many people are using the trails, and I know y'all see on Nextdoor all the people that, you know, complain about the problems that occur on the trails with people not following the proper etiquette and everything like that, from bikers to walkers to dogs to children to everything. It might be beneficial to stick out some sort of instructional video that suggests how to interact on the trail, because there's a lot of people that have never been on the trails that are on there now, especially with their earbuds and all that kind of stuff, that, you know, that they can't hear anybody coming around. And so, you know, it might be a safety sort of a message that you could send out.
You are absolutely right, Mr. Palmer. In fact, Plano Parks and Recreation today, it's not a video, but they did start pushing out messaging because they noticed that very same thing. So you know, we need to have you as our secondary for giving us great ideas. But they did go over some of those basics because it's surprising how many people don't know how to say on your left or how to manage that dog. I've never seen the trails so crowded. It's incredible.
Or to know there's a speed limit. You can't go 30 miles an hour a bicycle on the trail either.
Yes, you can.
Shannah, Greg, there was one more question. You mentioned having sufficient PPE. Will this cover a 3-month surge?
Yes, of course, we're planning much more long-term than 3 months. We look down the road. When I talked a lot about how we plan, you know, our strategic planning goes much further in the future than 3 months. And we have a good supply of PPE and we feel very comfortable. And of course, we work with the hospitals, we work with the doctor's offices and all the medical community as well to make sure that they have what they need too. So we feel very comfortable right now with the PPE looking into the future.
Right. And Cheryl had a recommendation to bring back the Plano Park Rangers who patrol the parks even after COVID. So.
Well, you know, the problem with that is you take personnel and you move them from one position that's because they're closed potentially to a position, a new position that they need because of the increased activity there. When everything goes back to normal, we're going to need those people back in the original place. But that would be in addition to the budget, which, as you could probably guess with the economic situation, we're looking to reduce our budget this year. So that will be something we'll have to consider in the future. But that is a good suggestion. I know it became very popular very quickly.
There's one more. Plano Fire Rescue. Are the Plano Fire Rescue people having enough hand sanitizer these days?
Yes. You know, the fact that you can make that sanitizer with alcohol was a big benefit because a lot of people that had access to those large amounts of alcohol turned those into sanitizers and donated those to the city and to the fire department. And really, when people think about donating things like PPE, they always think of fire first. So They've been going to the fire department and they've been receiving those and dispersing them accordingly to the medical community or within the city itself. And of course, our warehouse, we maintain all of that PPE and take a very close look at that. And we daily almost get updates on what that looks like. Sort of like we're kind of crazy with graphs and data, as you can see from our website. And we have similar type of accounting for our PPE as well.
That's all I see in the chat. Of course, is there planning for prep with the county for voting safely in November?
I think that question is probably one to be answered by the county, probably, since they run the elections. We contract with them for that. I hope all of you are registered voters, and I hope all of you went and participated in exercising your civic duty. Election day was yesterday, of course. I went last week and voted at PISD Administration Building, and I was very impressed with the effort that Collin County Elections had put into place. Just personally, you know, they had Q-tips. I didn't even have to push the, you know, buttons with my fingers. Everyone was masked up. There was a lot of social distancing. So Collin County Elections, unless you live in the Denton County section, then you'll want to reach out to Denton County Election and give them feedback if you saw an unsafe environment. Because certainly we keep our facilities very clean. So if the voting is happening in a City of Plano facility, that's very clean, but the actual administration of how that setup is done by that election group.
And as you can guess, I voted in a rec center.
You
when I
were
was
there.
But, you know, there was a great collaboration between the county and the city on those because they do use city facilities. And like Shannah said, the actual operation of it is with the county, but we do communicate and work very closely together. In fact, I'm going to be with one of the county commissioners talking to one of the Rotary clubs next week about such collaborative relationships.
Wonderful. So we're just almost at 1 o'clock. And so I really want to thank our speakers again, Shannah and Greg. I think, okay, everybody's doing little claps.